Well, you've probably heard that the Biden administration is letting the 3-year COVID-19 public health emergency expire on May 11th.
It is the biggest signal yet that the federal government believes the worst of the pandemic is over.
Well, what can the public expect when the emergency ends? UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us for his weekly visit.
Hi, Dr. Pothof.
Welcome.
Good to see you guys.
So what does it mean to us when the government says May 11th, the pandemic's over?
Yeah, I think for most people who are listening, what it means to them is during the pandemic, we've almost taken for granted that the things that we need to combat COVID-19 were free. I could go get a test. I can go online and order a test from the state that arrives at my door. That's free. I could get vaccinated. It cost me nothing. If I had COVID and I got sick and I needed monoclonal antibodies, Paxlovid, different medications, all covered. That starts to go away when this order goes away. It's not to say that those individuals who have private health insurance won't be able to get these things. Certainly they'll be able to get vaccines. Testing, they may have to go to specific, authorized sites to get that. We likely won't have free tests that come in the mail. The real challenge will be for those who can't afford insurance, who don't have health insurance. All that cost shifts to them, and by definition, they can't afford health insurance. It's likely they won't be able to afford these things that we've taken for granted for a couple of years either.
The Wisconsin Department of Health Services is working on a way that they can get you some free COVID tests, but not necessarily the vaccines. What does the vaccine cost out of pocket?
So Moderna and Pfizer are kind of signaling that if you needed to pay for the vaccine out of pocket, probably somewhere between $110 and $130 per shot. So if you needed a booster once a year, if you're uninsured, you'd have to pay for that. If you have any insurance, the Affordable Care Act or Obamacare requires health insurance to cover those vaccinations. So any of us who have some sort of health insurance will be able to get vaccinated for free.
But if you don't have health insurance, you're likely not going to fork over $130 for a shot.
Yeah, I think if you have a hard time paying for health insurance, you're going to have a hard time justifying paying $130 for a shot.
Does that concern you, that people are not going to get vaccinated?
Well, I think it goes back to this idea that, with these infectious diseases, it's not like me just vaccinating myself keeps everyone safe. We really need as many people as possible vaccinated so that we don't spread this disease around. So having folks that likely won't be able to get vaccinated doesn't just affect them, it actually affects all of us.
Well, in your expert opinion, are we in an endemic stage now, or is the government jumping the gun a little bit?
No, I think, with cases the way that they are, kind of past the holidays, not seeing big surges, at least here in the United States, speaking largely, seems more endemic. COVID-19 is still here. It's still a threat. We have to pay attention to it. But the idea that we're at risk for, sudden big surges or it's disrupting, daily life as we know it, doesn't really seem that we're too close to that. So endemic is probably the right word that we could maybe start using here in the United States as it relates to COVID-19.
But there are parts of the world still struggling.
Yeah, and I think that's why it's always hard, at the global level to say, are we out of the pandemic or not? It's almost one of those things where you look over your shoulder and then you kind of realize 2-3 months ago, maybe we came out of it. But there is enough COVID-19 and some struggles going on, particularly in China, where, if you ask the World Health Organization, they probably wouldn't say we're out of it. But certainly here in the United States, it's looking pretty good.
Why can't we just say it now? Why do we have to wait until May 11th?
Yeah, I think what we want to do, in addition to the things that are affecting consumers at home, is there's a bunch of different things that then change for health systems, things that are still supported and things that will go away. And health systems need a chance to transition that over. What are we going to do when these things aren't free? How does our messaging change? How do we offer these things to patients so that all kind of lines up? So I think having the runway to this is actually not a bad idea.
It's a lot of moving
parts. Little transition.
Yeah.
Right.
Doctor, good to see you again.
You bet.
We'll see you next time.
See you next time.